Cystic fibrosis is an inherited, incurable, progressive disease that results in permanent damage over a lifetime. It is incurable, however, there are many new medications that can make living with cystic fibrosis a bit easier. Before antibiotics were invented, usually people with cystic fibrosis died before they were school age. Ever since having antibiotics, it has enabled people with cystic fibrosis to live longer lives, and these days the median age of life expectancy is now in the 40s. The disease affects the respiratory and digestive systems, again, causing long-term permanent damage as time goes on. With the respiratory system, it involves the sinuses and the lungs. Cystic fibrosis is a genetic defect affecting the sodium chloride channel, which is faulty in cystic fibrosis, causing thick, sticky mucus that traps bacteria and allows infections to occur. In the sinuses, this causes polyps growing in the sinus cavity. Also, the thick mucus is hard to clear, causing repeated sinus infections, needing surgeries to fix this, as well as daily treatments to rinse out the sinuses. In the lungs, the mucus is very thick and sticky, so it's kind of like a petri dish where bacteria gets in there, settles in. It's a perfect, dark, wet environment for bacteria to thrive and causes infections, which result in scarring, and as time goes on, a decreased lung function. People with cystic fibrosis frequently need antibiotics and then, as a result, become antibiotic resistant over time to many antibiotics that are needed to treat them. Pretty much every adult with cystic fibrosis has at least been in the hospital one time, if not dozens of times. Usually a stay in the hospital is with IV antibiotics, and that is for 2 weeks, what is called a tune-up or a clean-out. And the person with cystic fibrosis receives at least 3 different antibiotics through IVs, as well as needing 3 to 4 or 5 airway treatments where they have to wear a vest or in some other way be percussed to break up that mucus. And those treatments take half an hour each. So imagine getting up in the morning and needing to get your day on. You have to get up earlier than other people, take a ton of medications, do your treatments, and then get on with your day. And then again, during your day, take time out to do more of those treatments, take more of those pills. It's a very exhausting treatment regime. With the digestive system in cystic fibrosis, the pancreas secretes enzymes that help you digest food. So in cystic fibrosis, most people have progressive damage done to their pancreas, and they need to take pancreatic enzyme supplements to be able to digest their food. And also the fat-soluble vitamins A, D, E, and K, those have to be made in a water miscible, I can't think of the word, instead of digested because of the impaired digestion. They had to reformulate the A, D, E, and K so that they can be digested by people with cystic fibrosis. Also, people with CF are prone to bowel blockages, so daily Miralax laxatives are very important to not let that occur. And as people are living longer with CF, unfortunately, they are more prone to bowel cancer. And the men with cystic fibrosis are almost always infertile because again, thick, sticky mucus, because of that sodium chloride defect, blocks in the vas deferens so that they cannot create children. Their sperm get blocked. So again, this disease is most common in people of Northern European ancestry. In fact, 30,000 Americans have CF, and about 1 in, over 10 million carry the gene. But just by being a carrier, you don't have any of the symptoms of CF. But it takes a mom and a dad to each pass on their CF gene, which there are over 7,000 mutations of this CF, to create a child with cystic fibrosis. Hospitalizations, lots of money are needed, lots of time again to treat this disease on a daily basis. It does take a lot of time and money. Thankfully, there's been something called a CFTR modulator, which is called Trikafta. There's also some Deco and Orkambi, which can, when taken on a daily basis 2 times a day, can almost make life normal again. It can't reverse any permanent damage, but it can make someone's body function like a normal person without CF. Unfortunately, this medication costs $24,000 a month, so it is extremely important that people with CF have affordable health care. And as you can tell, all the time it takes to deal with living with CF on a daily basis makes it hard, especially with frequent illnesses, for people with CF to remain employed, especially as they get older. So it's very important that we somehow can make it so that they can afford their medications, especially ones that save their lives and enable them to live longer and be more productive members of society. I had to take notes, even though I had a daughter with this for 25 years. I still have to sometimes remember all that goes into this. But again, it is incurable as of now, but this new drug that came out makes it more tolerable, but very unaffordable. Thank you.